Hello, I'm Dr. Yeui-seok Seo, a plastic specialist at Area88 Plastic Surgery. The number of facelift reoperations has increased significantly. Reasons for reoperation are in following orders: no change after the surgery, reappearance of sagging, and worsening of condition. These are the most common reasons. Reasons such as no change in the mid-cheek and nasolabial folds, unnaturalness, and too much scarring are as follow. This is a photo of a patient who had facelift once. Even after the surgery, the jowl fat remains as before and has what we often call a wind tunnel look as the result of unnaturally operated surgery. This is a typical look when only the skin has been pulled. A scar of 10 cm long and 2 cm thick was left over in the occipital region. The angle is too high and there is no case where the incision line is this long. Dissection should be performed up until the yellow dotted area to remove that scarring. It causes dissection to be performed on unnecessary areas and takes a lot of time for surgery. As for such incisions, a wide dissection is needed when a sufficient neck lift is needed. However, pulling it with force only with an incision shows such results. During surgery, the buccal fat was removed from the inside of the mouth, and a dual-plane facelift was performed. The buccal fat pad was vertically pulled up, and SMS was vertically elevated by 4 cm. Then, after the SMS facelift, inappropriate fat previously grafted on the mid-cheek area was removed with a Q-Zulp. Skin is not to be pulled. Only the skin that has been naturally left over should be removed, then sutured carefully. If you look at it from above, you can see that the mid-cheek, nasolabial folds, and cheeks have been corrected. What's being often misunderstood by patients and doctors about facelift is that there are many patients and doctors who think facelift is simply raising the skin upward or sideways in 2 dimensions like an arrows. Facelift is more complex than that. It raises the sagging area shown as the yellow arrows like the red arrows. This is called a radial expansion. And rather than calling it a facelift, it's called a facial reshape. The drooping and sagging of the face appears as people age. And also, it's due to damage to the retaining ligaments from the bones caused during zygoma reduction, sagging due to weight from excessive fat grafting or fillers, or damage to the retaining ligaments from liposuction. Due to such reasons, facelift is performed not only on older patients. Because of reasons mentioned, facelift is also performed on younger patients, especially in Korea. There are many reasons why facelifts may be ineffective or worsen the case, but the main reason is due to detachment and fixation of the retaining ligaments. I have uploaded videos regarding retaining ligaments in detail in 3 parts. If these retaining ligaments are clearly detached but is not fixed well compared to before, in most cases, the skin will immediately sag again, or have no effect, or the situation will even become worse. Furthermore, if these retaining ligaments cannot be detached up to the mid-cheek area, the situation has to be resolved by forcibly pulling the skin. In that case, it will result in wind tunnel look or in severe scarring. Thank you.